the conference today called Vaccine Heroes, based on the World Health Organisation theme for Immunisation Week this year. And every person here is a vaccine hero in their own way. We're so excited that people would give up their Saturdays to come and hear these amazing speakers and hopefully share their stories and what makes them a vaccine hero.
This is the 5th one that we've run. Started off as a small thing, about 150 people turned up, and this year we're going to have nearly 600 people, a big dinner, speakers from interstate, speakers from all over Australia, and local speakers giving really good up-to-date immunisation information for doctors and nurses and midwives in this area.
One of the two truly great public health innovations that we have, and clearly the most cost-effective one that we have, is vaccine, and particularly vaccination of young children. We've seen phenomenal gains in lives saved through vaccines like measles in particular, but other vaccines as well, whooping cough vaccines, influenza vaccines. And the thing that we probably should realise is that as vaccine effectiveness is so great, we see these diseases becoming rarer and rarer. And what that may lead to is complacency. Complacency and dropping in immunisation coverage sees these killer diseases re-established. So it's very important that we never sit on our laurels, that we make sure that every child that's born benefits from the wonderful public health innovation that is vaccines.
It's great to be up here for the Vaccine Heroes Immunisation Conference, which is really focusing predominantly on immunisation uptake in high-risk groups such as Indigenous children and families, pregnant women, also on vaccine safety, but also very importantly on using how we can use social and behavioural science to develop strategies to improve vaccine uptake and improve, focus on communities and improving uptake in those contexts.
My colleagues with me at the School of Public Health and Community Medicine, we're putting together a new education program that will be available to GPs in the near future, because we know that even though GPs get some grounding about travel medicine, things change. There are new vaccines, there's new policies, but we also just need to change the way maybe that we're communicating about vaccination and just the opportunities that we can take to try and promote it in new ways to try and increase the level of acceptance and uptake in our communities.
It's an exciting time that we're in, really. I call it the golden years of immunisation, the last few years where we're in the last 25 years, we've gone from just a few diseases we can prevent to multiple diseases we can prevent, some cancers. It really is very exciting. The other aspect is that I'm going to be talking a little bit about the ethics of immunisation and ethical issues that are brought up by immunisation. And there are a number of really fascinating ethical dilemmas that have come up over the years. So I hope the stories will persuade people to get their children immunised.
This is my first visit here to this wonderful conference, and I feel privileged to be part of the team and to come here and enhance my knowledge and meet some wonderful people.
All the speakers have been really to the point, great up-to-date quality information that's evidence-based, and I think we've all taken a lot already back from what we've heard.
And I've come to the conference today to try and upskill my knowledge on immunisations, which has always been something traditionally we've given to our nursing staff, but I thought that the time was right for me to upskill as well.
What I really enjoy about these conferences is that we can get together and we can be updated and we can get the education that we need to keep going and doing the job that we're doing. Vaccinations is such a vital part of community, and having this opportunity is fabulous.